South Carolina remains one of 10 states that have not opted to expand Medicaid since it became an option about a decade ago. But a new study finds around 340,000 South Carolinians could benefit if the state changes course. State House reporter Mary Green has the details.
This new report was commissioned by a group of nearly 200 nonprofits and community stakeholders interested in closing the health care gap in South Carolina. It aims to show the benefits of expanding Medicaid, long considered something of a third rail here at the Republican-dominated State House.
We need to improve health outcomes in South Carolina. We know Medicaid expansion will do that.
The study reports expanding Medicaid could benefit not only South Carolina's health outcomes, but also its economy. It estimates around 30,000 new jobs would be created across all 46 counties, attributing that to Medicaid dollars going to health care providers and then spreading out from there.
We know if they're employed, typically speaking, they're better off. They're able to meet their mortgage. They're able to help their children go to school. And meet all those bills. So there are other economic goods that ripple through.
It says South Carolina would gain more than $8 billion in federal funds in the first 3 years of expansion, with the amount of money the state would need to put in offset by federal bonus funding.
South Carolina taxpayers are paying their taxes, and they are essentially subsidizing Medicaid expansion in other states.
But it's unlikely South Carolina will seriously consider this action anytime soon. A provision in the new state budget would have formed a committee to study health care reforms, including South Carolina taking a legitimate look for the first time ever at Medicaid expansion. A spokesman for Governor Henry McMaster says he remains unconvinced about the findings of reports like this one. McMaster vetoed the study committee while acknowledging a need to improve access to quality, affordable health care.
I believe that studying and working toward the goal is worthy, but a 5-month study committee, I think, would not produce the kind of results and may actually slow us down.
Meanwhile, the governor's office claims the state's share of expanding Medicaid would cost more than $2.5 billion over the next decade, the annual cost rising to more than $380 million by the 10th year. It notes that's more than some state agencies, including the Department of Social Services and the Department of Mental Health, will receive in the new state budget to stay operational. Reporting from the State House, I'm Mary Green.